We can't wait. Good morning. I'm Isobel Mackenzie, Seniors Advocate for the province of British Columbia, and it's my honor to be speaking to you from the ancestral lands of the Lekwungen-speaking people of the Esquimalt and Songhees First Nations. This morning I'm going to be presenting the Office of Seniors Advocate 2023 Monitoring Report. This is an annual report produced by my office that looks at a large basket of services and supports provided to seniors in British Columbia. We measure progress year over year, and we generally look at what are the 5-year trend lines telling us in terms of our ability to meet the growing needs and demands of our seniors population in British Columbia. So first of all, we'll talk about our seniors population overall. In 2023, there were just over 1 million people aged 65 and older in British Columbia. That is 20% of our population. Over the last 10 years, the percentage of seniors population has shifted from 16% to 20%, and it's anticipated that that is going to continue over the next 5 and 10 years, and we will start to approach about 28% of our population 65 and older as we get into our next decade. As you can see in the age breakdown, the bulk of our seniors population is actually quite young. Over half of our seniors are aged 65 to 74. And you can see that how that population has grown over the last 5 years and over the last 10 years. A smaller but still significant population is in the 75 to 84 age group, but you can see that that population cohort has grown the most over the last 5 years and over the last 10 years. And 85 plus, which is our most frail population, is actually quite a small proportion of our seniors population. It's 2% of the overall population, but I think it's about 18% of the actual seniors population, or 10%, 11%, pardon me, 121,917, and it's grown the least over the last 5 to 10 years. So it's important when we look at this and we look at the data that's coming to understand where we are today in terms of our pressures on our systems and services for seniors relative to the demand that will be coming over the next decade. Life expectancy in British Columbia at the age of 65 on average is 21.8 years, a little bit more for women, a little bit less for men, but overall 21.8 years. That's actually seen just a little bit, a 1% decrease over 5 years, but a 1% increase over 10 years. And the reason for that little decrease over the last 5 years is attributable to a large extent the impact of COVID-19 in our seniors population. So you can see that the fatality rate, the number of deaths per 10,000 of seniors, increased 4% over the last 5 years. And when we look at the top causes of death, you do see how COVID-19 has had an impact. So in order, about half of our seniors are dying from cancer or heart disease and stroke. So that's cancer, heart disease, cerebrovascular diseases, which is stroke. COVID-19 actually ranks in one of the top 5 causes of death. That's 6% of our population. And then chronic lower respiratory diseases at 4%. Prior to COVID, diabetes would have been the 5th leading cause of death among seniors. So we definitely have felt that impact of COVID and its disproportional effect on the seniors population, and hopefully as we move forward and move out of our pandemic and out of COVID and see the effect of vaccines, we will see that trend reverse. When we look at our healthcare highlights, to illustrate sort of what we're experiencing today and what we might be experiencing tomorrow, I've bifurcated the population into the 65 to 84 age group. Remember, that's the bulk of our seniors. That's over about 900,000 of our seniors. And then 85 plus, which is about 121,000 of our seniors. So what you see here is in the 65 to 84 group, more non-users of healthcare, more low complexity chronic conditions than our older seniors population, about the same medium complexity conditions. And then you see very clearly the high complexity chronic conditions shift to a much higher rate in 85 plus from what we're seeing in the 65 to 84. And that's where you're starting to see real pressure on the healthcare system. This is about multiple visits to the doctor, multiple hospitalizations, utilization of long-term care, home support services, home care services. So you're seeing that most profoundly in the population 85 plus. Diagnosed with dementia, overall, I think it's just shy of 5% of seniors are diagnosed with dementia. But in the 65 to 84 group, it's 3%. And then you see that jump from 3% to 18% in the 85 plus group. Encouragingly, that rate has come down a little bit. We'll see how that trend holds over time. But there's no evidence to suggest the probability of dementia is increasing. In fact, the probability of developing it is marginally decreasing. And we still see the majority, 22%, of people 85 and older without a diagnosis of dementia. In terms of hospital use, when we look at the rate of seniors coming to our emergency rooms, we see that over the last 5 years, there's actually been a reduction of 8% in the rate of seniors coming to our emergency departments. There's more seniors coming, but the rate is lower. About 26% of all emergency room visits are for seniors, for people 65 and older, and they're about 20% of the population. So we can see that, yes, they have a bit of a disproportionate impact, but not overwhelmingly. When we look at hospitalization, so this means I've come to the emergency room and now I have to be admitted to the hospital, or I've been admitted to the hospital for a scheduled procedure. We see that, again, the rate has gone down over the last 5 years by 5%. But you see that almost half of our hospitalizations are people 65 and over. So we definitely see the pressure on admissions to hospital much more than we see the pressure on our emergency departments. When we look at alternative level of care, so this is a designation given to someone who is occupying a bed in a hospital, but whose acute medical needs have receded, and they could go home or they could go to a long-term care facility, but for any variety of reasons, lack of something being available, they're remaining in the hospital, even though clinically they don't need to be there. We've seen an increase over the last 5 years, a 14% increase in the number of people, number of beds occupied by these alternative level of care patients, and a 14% increase in the number of days those people are staying. But, you know, that's been equal overall, and so the average length of stay has marginally decreased, slightly less than 1%. Arguably, the length of stay has stayed about the same. The number of people has increased. When we look at home support services, so this is sort of the first level of care in the community that people would access. Over the last 5 years, the number of home support clients has increased by 10%, but the average hours of care they are receiving has decreased 4%. The government the minister did make an announcement yesterday regarding home support about increasing the workforce within home support, and hopefully as we see the impact of that, we will start to see clients who are receiving home support get back up to the hours of care that they need. But more significantly, the rate of home support has gone down over the last 5 years. So we've increased our clients by 10%, but when you look at the increases in the target population, we've actually experienced a real decline of 7%, expressed as the rate of clients per 1,000 population 75 plus. Adult day programs. So an adult day program is a very critical support for people who live in the community and their caregivers. So this is a program where my husband or my mom can go to a facility all day, 2 or 3 times a week, get a meal, maybe a bathing program, get some socialization, and I can get a day off. It's a very critical piece. We were making of the ability to keep people at home. We were making great progress at increasing it prior to COVID. but it was effectively shut down for 18 months during COVID and has not rebounded. So prior to COVID, there would be about 7,700 people in BC in our adult day programs. We've seen a 6% decline in the last 5 years of the number of clients, and a 21% decline in the number of program days. So we've got 6% fewer people, but we've got 21% fewer days available to them in order to utilize the program. I hope this trend can be reversed. Certainly there was a commitment from the government prior to COVID, and the resources were there to see this program grow. And I'm hoping that what we're seeing is just the end tail of the residual COVID effect. When we look at assisted living, so this is registered subsidized assisted living. So this is about 5,000 units in the whole province. And this is a person who, they get their own unit. It usually has a little kitchenette of some kind, but they get their meals in a common dining room. They get their unit cleaned once a week. They're still fairly independent, but they might need a little bit of care. Over the last 5 years, we've seen a 21% increase in the wait list for these subsidized units. We've seen a 16% decrease in the rate of subsidized units per thousand of population 75 plus. It's basically been flat. We haven't really added any units, but we have increased the care. So we're putting a little more care into assisted living for the people who are living there. That's a good thing. But we certainly need to look at increasing our number of subsidized assisted living units in the province, given the increase in the wait lists. Long-term care. So over the last 5 years, we've seen quite a dramatic increase actually in the clients waiting. So when we took this snapshot, March 30th of, I think, 2023, there were 5,175 people waiting for placement in a long-term care bed in BC. To give you an idea, we have about 29,000 beds. This represents a 136% increase over 5 years. And it is very clear that we are now starting to see an impact. And you can see how it's going to build if we're not providing the home support, if we don't have the adult day programs, if we don't have the subsidized assisted living. It's all going to lead to an increased demand for our long-term care beds. And we have not been building more long-term care beds. The rate, if you look at what we've built relative to the increase in the population, it's a 12% decrease. The average time on the wait list has also increased 54%. So people are on average waiting 209 days before placement. Interestingly enough, clients are 4 times more admitted from the hospital versus the community, 4 times faster. So you have almost equal numbers of people admitted from the hospital, people admitted from the community. But when you look at how long to get into that bed, it's 4 times faster if you're admitted from the hospital. And this, we have to monitor this very closely, because we do not want to set up a situation where people are incentivized to go to hospital as a way of getting in long-term care. And so I do expect that health authorities will be looking at this and will be determining how to more equally assess the wait times, whether you're in community or in hospital. Unfortunately, over the last 5 years, we've seen a 17% increase in the proportion of residents that are taking antipsychotics without a diagnosis of psychosis in our long-term care facilities. For some reason, consistently, before COVID, during COVID, after COVID, British Columbia has been above the national average and well above Alberta and Ontario in terms of residents taking antipsychotics without a supporting diagnosis. It's something we really need to look at, because there's not an underlying explanation. The population isn't that different. When you look at all of these other things that might explain, none of them are really answering the question, why are we so stubbornly above the national average? We did do a lot of work on this 10 years ago. In fact, it started a little before that. We did bring the number down. We were still above the national average, but we did bring our numbers down dramatically. And then we sort of stalled Then COVID came, we went back up, and we've kind of stalled. So I think that is an area we do have to revisit. In terms of Pharmacare, one of the things that I think might surprise some people, there was $1.6 billion spent on medication for seniors, but the seniors themselves paid for about 70% of that. So 69% of the $1.6 billion was paid for either by the senior directly or by their third-party insurance company. Government was only picking up less than a third of the tab. And in fact, the proportion that government is paying has been going down a little bit over the last 5 years. And so that's a timely thing to think about, particularly in the context of the national discussions around Pharmacare. Health Human Resources, or staffing as we used to call it. We do report on this. We look at the number of active registrants in our respective registries and colleges of those professions that are impacting our seniors. So over the last 5 years, we've seen a 14% increase in physicians, a 10% increase in nurses, 38% increase in care aides, and you can see a 19 and 18% increase in PTs and OTs respectively. Draw attention to the big increase in care aides. That is mostly focused on the last 3 years and is a reflection of the success of the the HCAP program, Health Career program, where the government actively sought people to come into the profession of being a care aide and provided supports for their education and opportunities for them to apply their practice, and it has clearly resulted in success measured by the number of registrants with the registry. Bit challenging on the nurses front, particularly as we look at the nursing ratios that we're going to be trying to achieve. That, in fact, has had the lowest growth of all of the professions and occupations that we are measuring. Housing, the main support for seniors who own their own homes. So just a reminder, about 80% of seniors own their own homes. About 50% of them are in single-family homes, and the other 50% are in apartments, condominiums, townhouses, that sort of a shared dwelling unit. Major program is property tax deferral. We saw 10,361 new users of the program. The new users went down over 5 years, although the total number of people using it has gone up 9%. And the average amount deferred is $4,700, and that's gone up 17% over the last 5 years. This is a very, very helpful program for seniors who are homeowners. The practical effect is if I deferred my property taxes of $4,700, that's $4,700 more I have to spend on other things. And I am puzzled by the very low utilization of the program. And we've begun some work that I'm hoping will continue that will be able to communicate more directly with seniors who are homeowners to advise them of the merits of this program. Renters. So about 1 out of 5 seniors is a renter in this province. And if they are a renter and they are over 65, they are overwhelmingly likely to be single, to be female, and to be low income. And we've got a couple of programs that support senior renters in this province. One is called SAFER, Shelter Aid for Elderly Renters, and it is basically a rent subsidy. You rent your apartment where you want, and you submit your papers to the government, and they do a calculation, and they send you an amount of money every month to help you pay the rent. When the program was first conceived about 45 years ago, the goal was people would spend about 30% of their income on rent. Unfortunately, the program has not kept up with the rising costs of rent and the overall rising cost of living. So what we have currently, there's about 23,500, about 24,000 people on SAFER. That's decreased over the last 5 years. And that's not because there's fewer people who need the program. Part of that reflects the income caps that have not been rising over the last 5 years. So people on pension incomes who get their cost of living increase find themselves bumped out of being able to access the SAFER grant, although they're still very low income and their incomes are still below minimum wage, but they're above the cutoff. So that's part of why we're seeing this reduction in the number of people. The average annual income of a person receiving SAFER today is $20,800. I'm just going to let that sink in for a minute. $20,800 is the average income of these 23,500 people. Their income has gone up 9% over 5 years, and that reflects increases we have to OAS, GIS, CPP. Their rent, however, went up 12%, and their SAFER subsidy went down 8%. I cannot emphasize enough the challenges with this program, and while it is well intended, it is not meeting the needs of seniors renters. What these data are reflecting is the system has something called a rent ceiling. So in Vancouver, the average rent is $1,696 a month. That's the average. That's not the average new rent. That's the average rent a person is paying for a one bedroom. The SAFER program only recognizes $803 of that. They have a rent ceiling. So every dollar of rent above that goes unsubsidized, and the senior pays 100% of it. They only subsidize $803 of rent. And because the rent ceiling is static, it does not go up every year by the allowable rent increase or by the cost of living, the seniors' income has risen because they had their inflationary lifts to CPP, OAS, and GIS, but their rent didn't go up because all we see is $803, notwithstanding that their rent did go up by the allowable rent increase. So we see a rising income, we see a static rent, and we decrease the subsidy. So notwithstanding the person's rent went up, their subsidy goes down. And I know that BC Housing is working on this, but they have been working on it for rather a long time. And there are people out there who are increasingly finding it difficult to pay their rent each month. Again, their average income is less than $21,000. The other program we have is senior subsidized rental housing. So this is an apartment building. All the people living there are 55 and older, and they pay 30% of their income to rent. It's a very good model. It's a model I worked with a lot in my previous world. And the problem is there's too many people chasing too few units. And so while we have had a 6% increase in the number of units over the last 5 years, we've added 1,765 new units. We've added 4,578 new applicants. So we've had a 58% increase in the applicants. While we've increased the units, it hasn't kept up with population growth. It's a 3% decrease in real terms. And the average wait time is 2.7 years. And there's been a 90% increase in the number of applicants that are waiting 5+ years. So even though the average is 2.7, some people are waiting more than 5 years. There's 11,549 people on the wait list, and in a given year, we're going to place about 865 of them. We consistently place about 7% of our units each year. So we can see that there's a challenge there, and also a challenge around building more of these units in our current environment. Transportation. Most seniors overwhelmingly are still driving themselves to where they need to get to and when they need to get there. 80% of seniors maintain an active driver's license. That's gone up 19% over the last 5 years, and that increase in large part is a reflection of the age cohort that's coming in. So it's younger people coming in, and of course they reasonably have a driver's license. In terms of the major public transportation that is of support to seniors, HandyDart, we have seen a decrease in the HandyDart clients in BC Transit, so that's everybody outside the Lower Mainland. We've seen a 6% increase in the clients in the Lower Mainland in TransLink, but we've seen a decrease in the rides given, so across the board. So if we look at BC Transit, the number of rides given has decreased by 43%. And if we look at TransLink, even though they've increased the number of clients, they're giving 27% fewer rides than they did 5 years ago. And so that is something I think that we have to look at, and we have to look at whether there's a new way to support seniors in their transportation needs when they can no longer drive. Income supports. So the median income for seniors, and that means that half of the seniors are above this amount and half of seniors are below it, is $33,150. That's a 16% increase over 5 years. The average income is $49,000, a 12% increase over 5 years. And it's very important to look at this significant difference between the mean and the median. So when you see a median income of $33,000 and an average income of $49,000, and you're realizing, 80% of seniors are not earning the average income, it's telling you the average is being pulled up by a small group of very high income earning seniors. And the more meaningful number is really the median, because that's really describing what the experience is for most seniors out there. So the median income, $33,150. By the way, that's a little below minimum wage. And as you can see, the main government pensions that seniors receive, the GIS, the OAS, the CPP, and then the BC Senior Supplement for our lowest income seniors, the average amounts in 2021. What's interesting is the average amount of GIS that people receive is about half of the maximum amount that they receive. So when we think about, you can get $12,000 a year on GIS, yeah, but most people aren't getting that. They're getting less than that. The same with CPP. We talk a lot about our CPP, about deferring to age 70, about all of these other things, but right now, the maximum CPP a person gets at retiring at 65 is about almost $16,000, but the average is $8,000. Most people are not getting their full CPP. Now, a lot of that will reflect women who didn't participate in the labor force to the same degree they are now, and over the next 25 years we might see that shift. But the reality today is the average CPP is about half of what the maximum CPP available is. The BC Senior Supplement, the maximum amount is $99 a month, and I think about 30% of people get the maximum. It's a small group of people, though. I think it's about, I want to say about 80,000 of our seniors. It's not indexed to inflation, but it was increased, it was doubled, so it was increased 100% back in 2021. So it's had a 100% increase over the last 5 years. In terms of safety and protection, on a good news, we've seen a reduction in reported missing seniors, 9% reduction in reported to RCMP, and 16% reduction in reported to Vancouver Police Department. So what we've done here is we've taken RCMP E-Division, which covers about 84% of the province, and we get all of their data in, and then we've picked our single largest police department at the moment, that's the Vancouver Police Department. Between taking those two sets of data, we are basically telling the picture of what's happening across the province. Notwithstanding, there are some small police departments, local police departments in other towns. We've chosen to take this approach. So fewer seniors are going missing. That's a good thing. Unfortunately, when we look at other indicators, we do see a bit of a worrisome trend line here. So 35% increase in the reported cases of physical abuse, 53% increase in reported cases of financial abuse from Vancouver Police Department. From the RCMP, we have a 15% increase in complaints of property offenses and a 55% increase in victims of violent offenses. 114% increase in cases of abuse and neglect of seniors reported to designated agencies. So the designated agencies are basically our health authorities, Public Guardian and Trustee, and Community Living BC. And 110% increase in abuse-related calls to seniors and abuse and information lines. So we can see, there's a fairly consistent pattern there over the last 5 years, and we want to think about that. I think maybe look to our law enforcement community and look at whether there's a way we can be more coordinated in our support of seniors who are in the community. Over the last 5 years, our federal New Horizons program for seniors in this province has seen a 75% increase in community-based projects, and they're all over from Terrace to down in Cranbrook, up in Fort St. John. All areas of the province have been receiving these grants, and they are really quite helpful to make communities a little bit more senior-friendly. Our first LINK program, that is run by the Alzheimer's Society of BC, and it is a program that people or their families of newly diagnosed dementia are referred for supports. And over the last 5 years, the number of clients has increased by 13%, and the number of client contacts have increased by 32%. So we're seeing more people, and we're really contacting them a lot more. But if you look at the population over 75, we really need to, it's been a decrease of 4% in what we would call a client rate. Our Better at Home program, again, 18% increase in clients, a 52% increase in the services provided to those clients. So, more clients, but even more services to the clients. And it's kept a little bit closer to the rate of growth. It's less than about 1%, just slightly less than a 1% increase in the client rate for the population. So generally, overall, what are we seeing? People are, for the most part, living longer and healthier lives. We have had a bit of a blip with COVID-19, and as we continue to measure over the next year or two, hopefully we will see that that's what it was and that our life expectancy rebounds a bit. Generally, we are mobile and independent well into our 80s. That data is fairly consistent. It's, as we get into our late 80s and early 90s is when we start to see conditions of frailty really impact our daily lives. The abuse, neglect, and the policing data are concerning, the increase that we're seeing, because it's such a consistent increase across all measures. If you sort of had a swings and roundabouts, it's up here, but it's down here, you might have a dip. But when you see that consistency, that is concerning, and particularly when you see it over a period of time, time series data of 5 years. Some services are increasing. We're adding more services. We are definitely adding more funding to our supports for seniors. But the increase in the population growth and our impact of just the delivering the same amount is costing more is really impacting access overall to our services. So access to services has reduced for the most part in most areas over the last 5 years, despite the fact that we have spent significantly more, despite the fact we have added some more long-term care beds, we have added some additional supported housing units, we have increased our number of home support clients. All that's true, but the population growth has basically dwarfed those investments. And the rising costs, which last couple of years we've seen inflation we hadn't seen before, is meaning providing just the same level of service is going to cost more. So these cost pressures on government are only going to intensify as we look at that population. The oldest baby boomer is only turning 78 this year. And you're really not seeing pressures until people get into their mid-80s. And the big bulk of our population is going to shift into that cohort over the next 10 years. And so, we're already seeing these worrisome trends. They're only going to amplify in the future. And so I think that governments have to recognize that, and the public has to recognize that as we plan for the future. So in closing, I will just say on a very personal note, this is my last report as the Seniors Advocate for the province of British Columbia. And it's been an honor and a pleasure to serve in this role for the past decade. I have been incredibly supported by seniors throughout this province, by staff both in my office and in health authorities, in the ministry, and a variety of service providers throughout the legislature and the community at large. I just can't say enough how grateful I am for the support that all of you have shown for the seniors of British Columbia. It gives me great hope for the future, and I really appreciate the opportunity to have had this privilege of serving as your seniors advocate. And with that, I will take questions.
A reminder to reporters on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. We'll start in the room. Mary Brooke, Island Social Trends.
Hi. You've covered a lot, and you've given a lot for the future to be considered. I want to drill into two topics. First question is about SAFER and how stubborn the response has been to responding to cost of living increase, rent increases. What's your thinking on why that's taken so long, and what is a target that you would recommend for a lift on the rent limit?
I don't know why it has taken so long. That would be a question I think the minister would have to answer. But I think when you look at what the rents are and you look at these incredibly low incomes, I think returning to this goal of 30% of income, which was the original idea behind the program, I think that should be the goal. When you look at the rent ceilings, I think you have to do two things. They have to be raised significantly. At a minimum, they should be raised to meet the average rent of a SAFER recipient. That's already below market rent. And then rents in this province go up every year by the allowable rent increase. And that should be built in, and the ceiling should go up each year to reflect that. Right? A senior who is receiving SAFER, the reason their rent is average rent is lower than the market rent is because of rent control. They've likely lived there a very long time, and so they haven't experienced the big market lift we see. But if that person has to move, it's catastrophic. They can't begin to find a place to rent for the average rent of a SAFER recipient. And we're starting to see the effect of that. Some of it is in premature admissions to long-term care. Some of it staying in a hospital bed longer. But it is the easiest one to fix. Senior subsidized housing, you got to build them, right? That's complicated. You got to find the land, and it's take years. SAFER is very quick to fix. Could be done overnight.
Also, regarding the longevity of seniors, their health, as you say, pretty much through their 70s, doesn't really start to decline to the 80s. We kind of know as a society now that physical movement is important for maintaining a range of health. Just wondering where in all those programs for seniors is the opportunity for seniors to really start bumping up their movement activity other than registering for an exercise class?
That's a very good question, Mary. We don't measure that. It's a good question about whether we should. Basically, most communities, certainly in the urban centres in BC, they have recreation centres. There are a variety of seniors programs that people will go to. And I think the role really is around getting the message out to people, which I think people do realize that. I mean, I think there's no end of messaging that, movement is good for you. And then making sure that those opportunities are there, which they are in most communities, but not all. Some of our rural communities struggle with that. And the transportation issue, right, would be the other support that we could give.
We'll go now to Andrew McLeod with the Tyee.
Hi. Thanks for doing this, and thanks for taking the question. As I'm sure you know, the government is reviewing the long-term care funding model. I'm wondering to what degree you've been involved in that, what your thoughts are on how it's shaping up, and what you hope comes of it.
I have been consulted. It is underway. I think it's not moving as quickly as anybody was hoping it would move. Whether it addresses the concerns my office has raised remains to be seen. I think the best way for me to express a funding model that I think would reflect a focus on resident need is a funding model that incentivizes the person receiving the money to deliver the care. And the funding model we have now doesn't do that because we give them an amount of money and they keep whatever they don't spend. And I think we need to shift that. And I think there's a belief that a new funding model will achieve that, but we'll see. My expectation is it won't be ready for implementation for at least a couple of years, but I would defer to the ministry to answer that question.
And as a follow-up, I've been hearing concerns from some people that the process could get hijacked, that the people who benefit from the funding model the way it is are involved and others haven't been. Are you hearing those concerns, or do you share those concerns?
I'm not so much saying I hear them. I share the concerns when you realize that there clearly are a group of people who are benefiting from the current funding model. It is not in their interest to change the funding model. I think that has to be explicitly acknowledged. It's not everybody. There are others who do want the funding model to change because they are explicitly not benefiting from the current funding model. It's that disproportionate. That's what I think is most alarming or should be of concern, might be a more appropriate term, is how when you look at our 300 facilities, take out the 100 that are health authority, you look at the 200 that are under contract, the unevenness of not just the funding, but what they're doing with the funding. That's what I think we have to fix, because clearly there's people who will benefit from a funding model where the incentive is to spend the money on the care. Some are doing that right now, but the ones who aren't are financially benefiting from that, and we just need to turn those incentives around.
We'll go to the phones now. We have John Hernandez from CBC.
Hello there, Isabel. We've spoken with a family based here in BC who have an elderly mother living alone in subsidized assisted care in PEI. They reached out to us because they've been trying to have her transferred to a subsidized care home in BC so she can be closer to the family, but she doesn't qualify for the province's wait list because she hasn't been a resident here for 90 days. I'm wondering, in your view, how common situations like this might be and what options there might be for families in these types of predicaments.
It's not that common, but it does happen when families want to move their loved ones, whether it's from the Maritimes or from Alberta. And there are a number of our home and community care services that require you to be resident for 3 months, and some I think might be 6 months before you're able to access them. And so if somebody is bringing their mom out here and their mom needs long-term care, but they can't get them on the list until they're here and they're a resident, I think their only option would be to look at paying privately for that care, which could be quite expensive, depending on whether they went with a facility that had private beds and subsidized beds. Those are the least costly versus the purely private model. But that would be, I think, their only option at this point.
So just based off that, is this policy that maybe the province should consider changing, just so maybe it would mean families can be closer together?
It's challenging because incentives matter, and so what you don't also want to do is set up a situation where I can't get into my long-term care home in another province, or it's more expensive in another province, and so I come to British Columbia. And what about the British Columbians who have been waiting on that wait list? It as a public policy question, it's a little bit nuanced in terms of what exactly the province should be doing.
Next, we have Michelle Bernoro, CTV.
Hi there. Thank you for taking my call. I'm wondering, what do you see as the greatest challenge facing seniors in BC? I mean, you've covered a lot of things today, but I'm just wondering specifically that. Is there one thing that really stands out to you? And do you see more seniors becoming homeless in the future because of increased rents, renovations, things like that?
So I think the biggest issue that seniors are facing, and exponentially more so for the seniors who rent, is this affordability issue. when you look at the incomes of seniors, they're 65% lower than the incomes of the working age population. The apartment they want to rent is in the same rental market. The rents there's not a senior's rate for renting. And so they are having a very, very difficult time. Then if you look at seniors who need home support services, so, and I've spoken about this before, BC charges for its home support services, and it's very costly. 70% of seniors have to pay for them. If you're on the GIS, you don't, but 70% aren't on the GIS, and so they have to pay. And that, even if you aren't a renter, if you're living in either a very modest home, you're in rural BC where houses are worth significantly less, or you have a reverse mortgage, any number of things. But when you're looking at home support costing $9,000 a year for a daily visit, if your income is $29,000 a year, you can see that this affordability issue is a very, very big concern. So I think this affordability issue over the population at large. When you look at the caregivers, this challenge around wait times, whether it's for long-term care, assisted living, and how we're not really allowing the home support programs and the adult day programs to provide the level of support they can in the community, I think there are issues there as well.
We'll go now to Ashley Joanneau from the Canadian Press.
Hi, I just want to pivot back a bit to the SAFER program to make sure I wrap my head around it correctly. If I'm understanding correctly, you're saying that because senior supports in a lot of cases are tied to inflation, when a senior's income goes up, they either get kicked out of the program or they get less of a subsidy because of whatever formula is being used, because it looks like their income is increasing. Is that essentially the nut of the problem that I understand?
The nut of the problem is this this rent ceiling, pardon me. So if you're in an apartment, your rent is going up every year by the allowable rent increase. But our rent ceiling is way below that. So we don't recognize your rent increase. We say your rent stayed the same, $803. Your income went up though, because you had your inflationary lift to your OAS and your GIS and your CPP. So we're cutting your subsidy. Even though the dollar increase in your OAS, GIS, CPP is less than the dollar increase in your rent. It's, percentages are relative to the base amount. 7% increase on $100,000 is a lot more money than a 7% increase on $20,000. And that's, I think, what is getting missed here when we talk about the cost of living increases that are provided to these pensions. These pensions are not robust.
Fair enough. I guess my follow-up question is just, this is your last report. What do you think the biggest challenge is going to be for the person coming in to fill your chair next?
Well, that's a easy question to answer, or easy question to ask, pardon me, difficult question to answer. I think the challenge, as I see it, is that people across this province, every elected official at every level in every party, everybody wants the seniors of this province to enjoy a dignified and safe life in their retirement years. However, the pressures that are coming, and you can see that clearly when you look at the population data, are significant. And the cost of what is needed to provide those supports and services is also increasing. So you've got two things happening. The cost is going up and more people are going to need it. If you just had one of those things, it would be bad enough. You've got both of them. And into the mix is in Canada, BC perhaps more particularly, just this overall issue of housing. but it is really going to be challenging over the next decade in terms of the supports and services that are going to be needed for this growing population as they shift from that sort of 74 to 84 cohort into the over 85 cohort, which is when they're really going to start to provide significant stress on the system. And remember, it happens year by year. You don't flip everybody over in 1 year, but you can clearly see what's going to be happening.
Thank you, everyone. That's all the questions for today.
Okay, thank you very much.